So question number 4, which is not true about Plaquenil as treatment versus COVID pneumonia? So we're going to go over some of the Plaquenil stuff. A, B, C, or D. Okay, so if you look at the JAMA article on pharmacotherapy, you can see that Plaquenil works on the inhibition potentially of the viral entry from the alveolus into the host cell, and it really inhibits endocytosis. Okay, so that's potentially where it affects. By the way, the arbitol targets the S protein ACE2 interaction and is used in, I believe, Japan. This was the first study that came out and made the headlines. In 20 cases, there was a significant reduction of viral carriage at day 6. This was by this French physician, and it was an open label, non-randomized clinical trial. He subsequently published a retrospective study on over 1,000 patients, of which 973 had cure. They were very mild patients, and they were all treated with high doses of Zithromax, about 600 a day for 5 days, along with Zithromax 500 for 5 days. That is interesting as well. Another positive trial was in Wuhan. It was actually a randomized trial, but looking at Plaquenil versus control in terms of a CT. These are also patients that are greater than 93%, so mild illness. You can see improvement versus the control, 80% improved in the Plaquenil group by day 7 versus 55% in the control. Of course, Donald Trump was very enthusiastic initially about the Plaquenil and Zithromax because of those studies, perhaps. And Dr. Vladimir Zelenko also reported at the same time in Kiryat Yoel in Lakewood that he was treating over 1,000 patients with high risk shortness of breath, and he would treat them with Plaquenil, Zithromax, and zinc, and he had a very low rate of hospitalization. There was also a telemedicine report in Brazil about Plaquenil, 800 milligrams on the first day, 400 for the next 6 days, Zithromax. And if they didn't treat, there was a 5% chance those patients were hospitalized versus treating early within 7 days of Plaquenil and Zithromax. Then some of the negative trials started to come in. Here's one from the VA hospitalized patients showing greater than 2.5 times likelier to die if somebody was given Plaquenil. And Plaquenil and Zithromax sort of evened it out, but if it's hydroxychloroquine by itself, adjusted hazard ratio is higher. And then further studies attacking the French study, saying that out of 11 patients, 10 out of 11 had worsening on the Plaquenil and Zithromax. Yet another trial published in JAMA, 1,400 plus patients treated with Plaquenil and Zithromax in hospital mortality. There was no significantly lower. It is interesting to note that azithromycin alone, 0.56 adjusted hazard ratio. Maybe that's suggesting that Zithromax alone might do something. I'm sort of intrigued by that. And then New England Journal of Medicine published an observational study of Plaquenil hospitalized patients with COVID-19, and there was essentially no difference between the composite endpoint, intubation, and death. The publicized Lancet trial of, I think it was like 90,000 patients. Yeah, 96,000 patients hospitalized during the study period in the multinational registry, but this was retracted because of the evidence. They failed to hand over the data when asked. So I don't know how to interpret this, but it's a little suspicious for not being positive in any event. Word about the randomized trial of hydroxychloroquine for post-exposure prophylaxis. This was just published in the University of Minnesota, a negative study for patients that were exposed to somebody who had confirmed COVID-19, very close to somebody. Dosing regimen was very high, 800 milligrams one day, and then 600 milligrams for 4 days, and it's very high. This was not coupled with Zithromax, and it didn't show an improvement compared to placebo. They both were about 10 to 15% chance of getting it within 14 days, which is not true about Plaquenil as treatment versus COVID-19 pneumonia. Targets the S protein ACE2. No, that's arbidol. It targets the endocytosis. Some early randomized control trials did show benefit. Yeah, that is true. The doctor from France, that was an open label study, but there were some trials there, that small numbers, that seemingly showed some benefit. Large negative trial from Lancet was retracted. That's 96,000 patients. Large negative trial on Plaquenil from New England Journal was not retracted. Correct. The observational study was not retracted. The observational study regarding cardiac patients was retracted, but that is the difference. So the answer is A. Thank you very much for listening. And let's